Okay, so for case five, um, case five describes the Logan family, uh, around seven children that are live in a low socioeconomic um, status area, and they are served by a small health clinic in the county, but they're only seen by nurse practitioner and dentist that don't come very often. And so the case kind of describes a school nurse named Miss Evans who recently noticed that one of the children, Michael, had an elevated fever and some swelling. And so she saw in his mouth and saw what looked like a large cavity and swollen gums. And so now Miss Evans is left with what should she do with her next course of action in terms of care and what kind of medications she should prescribe. And so our team is now discussing the different questions that we were given for this specific case.
So the first question asks to discuss the scope of practice for each professional named in this case. And the three professionals were the nurse practitioner, the dentist, and the school nurse, Miss Logan. So a nurse practitioner is responsible for evaluating patients, ordering and interpreting diagnostic tests, making diagnoses, and initiating and managing treatment plans, and also prescribing medications. And the level of independence for each NP can vary by state law. So in Texas, it's required for NPs to work within 75 miles of a physician who's providing supervision for their clinic. And also supervising physicians have to review a random 10% of the NP's patient charts each month. And also supervising physicians have to confirm prescriptions made by the NP. And in Texas, NPs also can't sign death certificates or handicap parking permits. For dentists, they evaluate, diagnose, and treat diseases and disorders of the oral cavity, maxillofacial area, and the adjacent or associated structures and their impact on the human body. And the school nurse, Miss Logan, provides first aid care, health assessments, writes care plans, and coordinates care of students with chronic or acute health conditions, communicates with teachers and staff to ensure safety and well-being of students. They also administer medications and monitor delegated medication administration. They assist in evaluating students for special education and special services, and they coordinate and provide vision and hearing screenings, assist families in accessing health insurance and healthcare services, and educate and train the school staff on care for asthma, life-threatening allergies, diabetes, and bloodborne pathogens.
Question number 2, how can interprofessionalism address this situation? The healthcare professional that primarily cares for the Logan children is the school nurse. The school nurse is responsible for notifying the parents of the child's condition. However, she can collaborate with the dentist and nurse practitioner to create a care plan for the child. For instance, with the parent's permission, the school nurse can share the urgency regarding the child's condition and the family's inability to travel to the health clinic with the nurse practitioner or dentist, or at least provide their contact information with the parents. The nurse practitioner or dentist can then plan a date to see Michael and discuss potential treatment options depending on Michael's diagnosis. Both the nurse practitioner and dentist alone can diagnose Michael. And in the case that the nurse practitioner diagnoses Michael, they can further refer him to the dentist. If necessary, after starting therapy, the nurse practitioner or dentist that treated Michael will discuss with the parents and perhaps the school nurse on Michael's treatment plan in order to help him stay compliant with his medications.
The third question is, what are the risks of administering medication without authority? Assuming the school nurse in this case is a registered nurse, she has no authority to administer medication to a patient without the authorization of a physician, or in this case, a dentist. Also, especially because she does speak of giving him a controlled substance. The idea the nurse has of following this treatment for Michael Logan falls under nursing malpractice. In this case, the nurse is subject to losing her nursing license and could face criminal punishment.
The next question asks us to discuss when it's appropriate for health professionals to work outside the scope of practice. And although difficult to answer, a good way to look at it is in the context of global health. Our group discussed an article where they interviewed several healthcare practitioners that had traveled to a global health setting and asked them under what circumstances they have seen others or they themselves practice outside of a scope of their practice. And the themes seem to be that in emergency situations where lack of alternative options were unavailable seem to be situations where that was okay. For example, where you might be the only option available to a patient, or where there's a case of imminent danger, such as a patient being near death on the side of a road, or where not doing anything at all would result in an adverse health outcome anyway. Some impactful quotes regarding the situation were that sometimes a person visiting a country in a global health setting is not in the best position to judge this without understanding environment, culture, and language. So, these are some key factors that can be used to judge performance when considering practice outside of scope as well.
And so for my question, asked, what kind of courses of action has Miss Evans as a school nurse exhausted? And so in terms of things she's done, she's already done a physical exam and kind of assessed the situation. But I think other things she could do is take more vitals. So I think there's only a temperature mentioned. And so she could definitely take vitals and kind of assess whether or not it's an emergency situation, as kind of described in these previous questions. And then in terms of other things she can do, I think the case mentions that she moonlights at a hospital. So I know she's definitely has other physicians or nurse practitioner colleagues. She could even call one of the NP or dentists that regularly comes to this community to potentially set up some sort of telehealth visit or some sort of HIPAA uh, HIPAA compliant setting where they can prescribe medications or provide some sort of healthcare guidance. And then lastly, there's a nice PDF that the Board of Nursing from Texas provides that helps nurses kind of assess, what exactly can they do in each situation. It can be very helpful in this situation. So Ms. Evans could definitely utilize that tool to help her see what else she can do in this setting.
Okay, so my question was about the implications of health literacy for this family. So they have a low socioeconomic status. Based on this, they would have pretty low health literacy, and the implications are a wide range. This is more from a community health standpoint. So they can have mild infections, cuts, or scrapes that could worsen into something as severe as sepsis, broken bones that might not be addressed in a timely manner, spreading communicable diseases unknowingly, thinking that they have more of a simple cold. Long-term chronic diseases could be compounding into systemic issues such as tooth decay that can actually end up turning into something severe like endocarditis, lack of immunization access, poor nutrition, because if they're living somewhere rural and they have financial struggles, they're going to have low access to quality foods. This is also going to compound with increased risk of diabetes, obesity, alcoholism, and lack of sexual education, so maybe increased STIs. And then they're also going to have poor access to social and psychological support, so they're not going to have a lot of mental health resources.
And I think that was our last question. So I think we all thoroughly enjoyed this case in terms of kind of assessing scope of practice. And I think it was a really good example of how to think about these kinds of situations. Thank you for the opportunity.